Hi, this is Dr. Pat Sharp. I'm the clinic director at Neuroeducation, and I'd like to talk to you a little bit about some actions of what you can do if you have a child with ADHD. We have seen over the 41 years of neuroeducation's practice lots of kids with ADHD, so I've kind of whittled it down to the gems. Um, Rule number one, which is the probably most important rule to help your child and help the family with this, is to try and keep it positive. Um, yes, you have to be the disciplinarian, um, but keep in mind that they will always be in the now. Right now is what they want, and they want it now. And so they're attracted to whatever is biggest and brightest in their world. And keep in mind that being positive is naturally quite bright, quite good. So, however you can manage that, the better. And then think in terms of having a positive bank account, like a bank account of good and bad times in terms of behaviors. So try to keep that balance always on the positive side, which means, laugh, but not sarcastically, not as, oh, I can't believe it, laugh, but laugh like you really enjoy being with your kid, not when he's necessarily making wrong choices. And hugs a wonderful way to communicate, but only if they're willing and touchy feely and accepting of that. Don't hug a child who's, inflamed and overwhelmed. That'll only make it worse. Uh, just make a decision that no matter what this child does in the next hour, let's say, I'm not going to nag, not once. And when he apologizes, and they do that, they will apologize, accept the apology. Don't add to it, yes, but if you really were sorry, you wouldn't do it again, because then you're setting him up for doing it again, which he will do anyway. But so just accept the apology and thank you. That's the right thing to do. Find something every day, many times a day, to praise. Anything, any small thing that he does. So here's some cardinal sins in the research about living with an ADHD child. Don't nag. It never works, ever. Don't lecture. Same thing, doesn't work. Don't argue. An argument takes two. Don't engage in the argument when he gets argumentative or she gets argumentative. And don't offer unscheduled advice. In other words, it's okay to give advice if you tell them, okay, now you want to go to the store with me, so I'm going to give you some advice when we park in the parking garage or the parking lot. I'm going to give you some advice about what I want you to do, and then you give them what your expectations are about how he's to act, and make it short. I mean, don't overwhelm him with a 45-minute shopping trip, and then praise him unduly through the process of when he is doing what you've asked him to do, and hopefully you get your shopping done and you get back in the car without a major incident. So I want you to picture something. Um, Imagine that you get pulled over for running a red light. And granted, you know when you run the red light that that's probably wrong. Whereas your ADHD child, in his moment of, I want it, and it's the brightest thing right in front of me right now, and I have to have it, um, he doesn't know that it's not right. So anyway, just imagine you've run the red light. You didn't see the cop. He sees you. You get a ticket. And then on top of that, he starts calling you stupid and worthless. And you know how that feels. So when you hand out punishment, leave the nasty comments out of it. That really doesn't add anything. Just give the consequence. And our experience has been the single most effective consequence, and probably the only one that we've ever had an experience that works since like 10 years ago, is to take away screen time. And not for days, but screen time for an hour or 2 hours, depending on the nature of the offense. So here's some other tips about trying to not engage in an argument. Don't get into a shouting match about whose fault it was that he made a wrong choice. Just state that this was the rule. Um, you weren't to eat cookies before dinner. You broke the rule. You ate cookies before dinner. This is the preset consequence. If you eat cookies before dinner when you're told not to because mom baked today, and I told you no cookies before dinner, then the consequence will be that after dinner you will have no screen time for an hour. And then commiserate. I feel your pain. It's like, um, I'm sorry, I know this is hard for you. I know you don't like giving up your screen time. So it's okay to criticize the behavior. Talk about it as the behavior, not as the child. It's not, it's like eating the cookies when told not to eat the cookies. So focus on the behavior, eating the cookies, not you were bad because you ate the cookies. Um, okay, second rule is, and this is a big one, this one helps a lot, keep calm. Stop yourself, breathe, take some breaths, get your head organized. Realize that the child standing in front of you has a deficiency in his brakes. He can't stop himself. So you need to stop. Diffuse it by lowering your voice, almost whispering, but not so that you sound like you're kind of overdoing it. No matter what, stay calm, state the rule, but only state it once. Don't keep repeating it. And then if he's raving and out of control, just leave or send her to her room. And if she can do that, great. If she can't do that, then you leave. Um, because and keep in your head, I can't reason with this child right now because he's just this out of control blob of neurons that are feeling overwhelmed and overfiring. Once he gets or she gets under control, then offer a choice somewhat kindly, like third one. But meanwhile, 4 or 5 months have gone by, and it makes everybody feel kind of hopeless. A newer thing that started about 10 years ago and is now available in Spokane is a thing called pharmacogenetic or PGT testing, and where they match the meds that are going to work for your child because they match his DNA. And there's been research studies, and that's the body of evidence or body of documentation that they have to say that these medications work better with people with this kind of chromosomal structure as opposed to these other ones. Check out this web page just to get more informed about it and what it is. It used to be that insurance companies did not pay for that. The price is down now for the testing. It's just a swab. It's a cheek swab, and they send the results to your doctor. He has to initiate it though, and he gets a little kit, from a little bottle with the swab thing in it to do. And he comes into the office and does the swab, and then the doctor is able to make better, more informed decisions about which medication. So you're not having to go through this guessing thing for months and months and months. So that's definitely worth looking into. Okay, now for the teachers, good idea to use lots of visual aids because visual aids are stable. They stay there. And in ADHD, anything temporal that passes in time, they lose it. It's said and it's gone. Or it's like listening to Swiss cheese. I mean, if you could listen to Swiss cheese, it's like it's there, it's gone, it's there, it's gone, and they can't put it together. So the visual aid thing is really, really good. The other thing about schools is warn that particular child about any transition that has to happen. Like they're moving now to art, or they're going to go to PE, and even though it happens every Friday or every Tuesday or whatever it is, be sure you remind them that today is the day at 10 o'clock when we transition to music. And then they're going to need supervision through that. That doesn't mean they're bad. It just helps them to stay on track without running off the road. Another piece for them is not as a punitive nature, but to invite them to sit close to you. Try to befriend them because that connection, even though you're the teacher and you're the person in authority, feeling like the teacher's on my side can really help a kiddo. So maybe he could sit close to you with one other child, like at a double, two seating at a desk, or alone, but never at a group table. That's just too much stimulation, too much overload. And then when he's kind of going off the tracks, call their name, but do it with care. Not just Stephen with a glare to the voice. Just make it a caring Stephen, and make eye contact, look at him, and then talk to him about, I want you to, and state the positive thing you want. You can tap the desk, you can smile, you can alert him when he's about to be called on so he's ready. He knows knows that he's going to be called on because you tapped on the desk and that's something you chatted with him before about. Now I'll give you a setup so you know it's coming. And allow for movement for those kiddos that are hyperactive. Um, ask him to be the one to hand out papers often or pick up student papers when they're passing them in. Allow him to fidget or have a little fidget toy in his hand. Definitely don't take recess away because he needs that. Don't use recess as a punishment. Now, for grading, be careful that you're grading on knowledge, not organization, or how it looks, how the handwriting looks. Remember, all of that's a disability. For the notebook organization, the kind of classic one for the schools is the 3-ring binder for all the subjects. One section for each subject. The bifold homework folder for papers going out to go home to do homework and papers that are done coming back. And then a monthly calendar kind of option that might be useful to use in the classroom is one of the many kinds that are available on timeanddate.com. So check into that. And then this may sound like over-helping the child, but it's just meeting his needs. It's not over-helping him. He needs it. Tape the assignment or the whole week's assignments into the book in which the assignments are. So if it's a math book, scotch tape in that week's assignments in the front inside cover of that book. That way they're all in one place and he has a better chance of getting them done. And it can't be, well, I don't know what I'm supposed to do. I can't find it. And do use mom and dad if you can, because they're on the team and, keep them in the loop, work together with them, listen to them. They know this child better than you. They've lived with them their whole life. Now, for parents, same thing. Work with the teacher. Help them understand your kiddo. And whatever plan you suggest, make sure it's doable. I mean, keep in mind that she or he has 30 plus other students sometimes in a classroom, and it has to be something that they can do. And also, instead of just talking about we should do this, that, and the other, make it very clear who does what. And then again and again, kind of have that necessary conversation and actually maybe show them by doing the math that even if they did 4 days of homework and they got 80%, which is really good on 4 days of homework, and they get a 0 for the 5th day because they haven't done any homework on the 5th day and it's due, that's an average of 64%. And typically 65% is failing, so that's not going to work. But if he understands that, then at least there's a shot. And again, even if he turns in something, even if it's one line, even if it's one word, even if he's just got the date and his name and number 1 in one word, give him some credit for turning it in. Don't not accept it because it's not complete. And that works for normal kids, and that's appropriate for normal kids, but this isn't a normal kid. This is a disabled kid. So keep all of this going. Be their frontal lobes by being this ongoing, loving supervisor. They know what to do, they just can't actually do it. So, in conclusion, this ADHD thing is a lifelong plan, and it will change as the situation in their lives change. You're looking at a plan that's going to have to last 50 plus years, at least. But have some fun along the way. Don't lose your love for your child. He's a wonderful person. He has some big problems. The winner is the family or the classroom that stays together. That's the winner, and that's the goal. So I hope you picked up some little bits of good information here, and thank you for listening. Bye.